Acne most likely has troubled most of us at one point or another, whether it pops up during our teenage years or hounds us in our adulthood, or both. Its presence is unwelcome to say the least, and many think acne is just a singular problem, but in reality it's a complex issue with varying levels, causes and treatment methods. If you've ever felt overwhelmed by the numerous products on the shelves, the conflicting advice from friends, or all of the home remedies available on the internet, then you're not alone. This video will help you understand the different types of acne, their causes and how to treat them, so you feel empowered to take control of your skin's health. Now, from my experience, acne is mainly caused by 3 different factors. Number 1, oil quality. Number 2, your skin's pH level. And number 3, clogged skin from makeup, dirt and oil. So firstly, acne is a blockage or an infection within the sebaceous unit, the hair follicle with our sebaceous gland. If you take a look at this diagram here, we can see that the hair follicle runs through the epidermis and the dermis. Attached to the hair follicle is a sebaceous gland. This is where we produce oil known as sebum. Our sebaceous gland releases oil into the hair follicle, and it should flow nicely onto the surface of the skin to lubricate, to keep our skin moisturized and protected. But when it comes to acne, the types actually fall into 2 different categories: inflammatory acne and non-inflammatory acne. Non-inflammatory acne is your open and closed comedones, blackheads and whiteheads. These sit at a level 1. Level 1 is when we have mild congestion, it's the most common. We have a blockage within the skin, and this occurs right at the top of that hair follicle. This occurs when we have oil coming through and it creates a plug at the top of the follicle. Whiteheads are non-oxidized clogged pores. Sometimes the oil plug oxidizes from the UV light and then can turn into a blackhead. So blackheads are essentially little plugs of oil that have oxidized and gone dark at the top of the hair follicle. With open and closed comedones, there are no redness or inflammation in terms of it being sensitive to touch or any pain associated with the actual comedones. Now, non-inflammatory acne, such as comedones, is easy to treat and get on top of. Then we have inflammatory acne. This includes papules, pustules, nodules, and cysts. These 4 types of acne are broken down into 2 levels. Papules and pustules sit in level 2, and this is when we get a blockage further down the hair follicle within the epidermis. What happens here is oxygen stops getting to the area. When we have no oxygen, our P. acne bacteria thrives. It is the main reason for creating infection within the skin. We all know when our body has an infection, we get swelling, pain, and redness. Papules are small, raised reddish bumps on the skin surface. They do not have pus. Papules can be tender to touch and might feel hard as well. When our body starts to fight the blockage, our body starts sending white blood cells, and that's when you start to get pus. This blockage is called pustules. The body may get rid of these on its own, as it will fight the infection and try to push the blockage out. However, many people like to pop these pimples. That leads to spreading that bacteria across the surface of the skin and can lead to more breakouts, but as well as scarring and hyperpigmentation. The pustule can actually heal itself from the inside out if we leave it alone, normally within that 1 to 2 weeks. Level 3 is when we get blockages further down in the hair follicle. When this occurs, the body recognizes that the blockage is actually too far away from the skin surface to push it out. So instead, it actually keeps the infection in the body. Your body will send other enzymes to break down the blockage and return the skin to normal health, but it can take a really long time, right? Painful, deep pimples in the form of nodules and cysts that never come to the skin surface. Now, the problem with these blockages, they are close to the dermis, which means if our collagen and elastin get damaged while you have cysts or nodules, it can actually lead to really bad scarring. Now, scarring can only be treated with microneedling generally, or advanced skin treatments, so it's best to consult with a skin professional if you're trying to treat acne scarring. Cystic and nodular acne are harder to treat as they are very deep within the skin. So this is the 3 types of blockages you can experience with acne, level 1 being the mildest, and of course level 3 being the most severe acne. So let's discuss what causes these 3 types of blockages. So essentially 3 things have gone wrong in the skin. The first thing is clogged pores. This is made up of dead skin cells as well as products, makeup and sunscreen. When your oil can't escape onto the surface of the skin, it gets stuck underneath the blockage. This is why it's important to cleanse your skin correctly, exfoliate and avoid products with ingredients that are clogging the pores. It can also cut off oxygen to the area of the hair follicle, which can then lead to level 2 pustules and so on. The second issue is your oil quality. We want our oil to be free-flowing liquid that can get through the hair follicle onto the top layer of the skin. The hair follicle passage gets thinner as we get to the top of the skin, so your oil quality needs to be very healthy and thin to get through. Most people have unhealthy thick oil, which of course can't fit through that passageway to get onto the surface of the skin. So when this occurs, it actually gets stuck and then causes a blockage and then leads to level 1, 2, or 3. The third reason is your skin's pH. Your skin should be between a pH level of 4.5 and 6.5. This is healthy. It needs to be slightly acidic to keep free of bacteria and have a strong immune action. If your skin's pH is out of whack, those with acne often have an alkaline pH, which is out of balance. Bacteria, pathogens love an alkaline skin, so we need to ensure our pH is balanced between 4.5 and 6.5. Okay, so now we know why you get acne breakouts and the types of acne, but how do we treat every type of acne? The first important step is exfoliation. We recommend a leave-on serum with salicylic acid as the key ingredient that has a small molecular size that can actually penetrate oil and exfoliate the skin from the inside out. Salicylic acid is oil soluble. It is attracted to oil to break it down. Salicylic acid is also anti-inflammatory, which can help to calm the skin down. And finally, it is also antibacterial, so it gets rid of that P. acne bacteria. It's the only acid that can do this, so it's the best choice for acne. We don't recommend physical scrubs as this can spread bacteria, causing more breakouts, but it can also irritate the skin by creating micro tears within the skin. We also don't recommend salicylic acids in cleansers alone as your exfoliation method. Cleansers are only on the skin for less than 1 minute, and it just isn't enough time for that acid to go into your hair follicle and clean up the mess of which your blockages and infections are. So using a leave-on serum with 2% salicylic acid that has time to work on the skin, and use this regularly during the week. If you have severe acne, you may need to look into booking in with your local skin professional for some chemical peels that are at a higher strength. Please do not do chemical peels at home. These need to be applied and removed correctly by a professional skin therapist. Next, how do we regulate our oil flow so it's nice and thin? So if you continue to have thick oil, it doesn't matter how often you exfoliate, you will still get recurring breakouts because you haven't fixed your oil quality problem. Oil quality, let's talk about it. The way we change the oil quality is increasing your essential fatty acids in your diet, including avocado, fish, nuts, foods that are high in essential fatty acids. Supplementation can also be taken daily to encourage the body to create better quality oil so we can prevent blockages within the skin. And finally, the skin's pH. 4.5 to 6.5 is where we want our skin to be. The best active ingredient to balance the skin's pH is vitamin B3, otherwise known as niacinamide. Anyone can use niacinamide, and the active ingredient helps to strengthen the skin's barrier, reduce redness, and balancing the skin's pH, increasing hydration. Niacinamide is also great for hyperpigmentation we can get from popping and picking our pimples. So it will help prevent and treat the hyperpigmentation left behind by the breakout. And finally, vitamin A, which is retinol. Retinol helps remove dead skin cells, it stimulates your cell production, it prevents excess pigmentation, it regulates your oil production to be at a normal level. It will help regulate the amount of oil your skin is producing. It's not going to fix your oil quality, only essential fatty acids can do that. It's also going to stimulate the fibroblasts in the dermis that encourages your collagen and elastin to produce more proteins. This will help prevent scarring and treat it if you already have scarring. So now genetics, hormonal factors, diet, medications, and your overall gut health can affect 3 above factors. We can help with skincare, but try these first, and if you notice no difference in 4 months, we recommend you go to a naturopath to look at your gut health and get some testing on your hormone levels to get to the underlying root problem and work from the inside out. For cystic acne, please consult a dermatologist. It is the most challenging to treat, and you may need short-term acne medication with oral retinoids. So here is an example of what your skincare routine could look like to help with acne. Now this will depend on each person, and again, you might need to tweak this routine depending on the severity of your acne. So if you do have any questions, feel free to pop them down below and we'll see if we're able to help answer those for you. So start by cleansing, then you're going to tone. This is optional. Then you're going to apply a leave-on exfoliating serum. So this needs to be salicylic acid, or you can use a leave-on serum that contains both salicylic acid and AHAs. Just a leave-on serum. Then moisturize, and then applying a SPF. Then in the morning 2 to 3 times a week, on the other days, you're going to cleanse, tone, apply a niacinamide serum, moisturize, and SPF. Now, we don't recommend to use niacinamide and salicylic acid together because most brands, they are actually conflicts, unless your brand states otherwise. So always look into the brands that you are using and just see what they recommend. It will depend on their formulation. So if in doubt, like I said, just contact your skincare brand and otherwise use on separate days. Now, another thing about skin purging, really monitor how your skin responds to how often you are using your exfoliating serum. You will most likely experience skin purging, which is when you break out more because your skin is pushing out the clogged buildup underneath your skin onto the skin surface. So push through it, you can do it. Let's take a look at your night routine. So starting by cleansing the skin, you want to double cleanse, so cleansing twice. Tone, just make sure there is no AHAs or BHAs in your toner, and then you want to apply a vitamin A serum. You will also include niacinamide in your night routine as well. So if your vitamin A is water-based, use the vitamin A first, followed by the niacinamide. However, if your vitamin A is oil-based, then apply the niacinamide first, followed by the vitamin A. It will just depend on the product formulation, but use both in your routine. Then you will finish with moisturizer. So reminder, serums need to be applied thinnest to thickest. Water-based serums first, followed by oil-based serums. If you are brand new to both salicylic acid and retinol, you do need to start off slow, so don't overdo it. Remember, while acne can be frustrating and affect our self-esteem, understanding acne and how it is caused is the first step. Stay patient, consistent with your routine, invest in good quality skincare, and always consult with a skin professional if you're unsure about the right treatment for you. If you have any questions, please let me know in the comments. Don't forget to subscribe for more videos and hit that notification bell. If you are interested in learning more about acne, then check out these videos here next.